Hey everyone, well I'm so thrilled to have Dr. Sonia with Elite MD back on with us today. So nice to see you, Dr. Sonia.
Hi, Jules. You too. Thanks so much for having me.
Yes, well listen, as we talked last time, I wanted to get really on I wouldn't even say back on a good skincare regimen because I never really had a great skincare regimen. And I'm so fortunate to have you on today. I know you do all kinds of really skin color, women of color, we're all some color. I mean, even though I'm like hardly any color at all, it's still a color, right? So for me, what I did was I ordered all the products that you had recommended for me personally. So I just got my box. I'm so excited this morning. So I'm glad you were available to come on at short notice, but that's how you are. You're aim to please, right? And even though I just want to shout out, even though I'm in Orange County, I split my time between Orange County and the San Francisco Bay Area still. And what I love about Elite MD is that, of course, you have an office in Danville. You also have one in Beverly Hills. But people come to you from how far, Dr. Sonia?
Oh my gosh, we get people from like all over. I mean, I'm surprised people come like 3-4 hours away sometimes to come to see us, and it's for just a consultation. They're with us for maybe an hour at the most. But then at the same time, the other day I had somebody from like Australia who wanted to order my products, and I'm like, well, I don't know, can I ship internationally yet? So
Exactly.
I've got to have some like actual protective measures to make sure that I can actually ship products abroad. So we get people from literally all over the country and really all over the world, and Instagram and social media has really connected us. So we're so blessed and so happy to be able to share. It's like it literally is a small world. We're all connected in so many ways. So I'm really excited about that part.
Well, you know what sets you apart? You're an MD, obviously. You're a board certified dermatologist, but you're also one of the girls. So that's why that's why I think you have so many patients and you're great to connect with. Well, here's my package. Yay. So I have not opened this yet, by the way. I don't even know what you sent me, but this is what I love about Dr. Sonia. You don't really have to think. She just gives you what you need. So I'm thrilled. So you have to tell me, Dr. Sonia, I'm the first to admit that I need help. And, we can't talk about we're all in this together. We're all in this together. I can't do my face by myself. Look at these packages, girls and guys, right? Because you have skincare for men as well. So I'm going to, everyone loves a little confetti, so I love that. But I'm going to take out what you sent me. And you know what else? I go into your office when I'm up in Northern California, which is about once a month. But it's also fun to get something in the mail. I mean, let's face it, right? So I was so excited.
It's like a Christmas gift. I love getting things in the mail. I'm like the first to open it if it's my name on it. It's great.
It is. But you know what else I think about skincare? And I mean this so sincerely. You know when you get on a plane and they say, just in case of an unlikely emergency, put the oxygen mask on yourself first and then your child, if you have a child with you. You know what I equate that to, Dr. Sonia? We have to take care of ourselves first to help everybody else, right? Mm-hmm. Whether that be work or family or whatever it is. So for me, if I'm taking care of my inside and my outside, including my skin, mm-hmm. I'm better equipped to take care of everybody because I feel better about myself. Is that a true thing in the medical world?
God. You know, the one thing that happened during quarantine, I don't even think I've shared this with you yet, but during quarantine, we were literally like together for so long and we didn't get a chance to get out. And so I'm all about, well, what's next for me? What else can I do? What else can I do for myself and help? So I actually started a podcast. Oh, and it was one of those things that I'm like, one day I'll do this. I don't know when that'll be or how it'll happen. But literally during the quarantine, everything just came together. And my husband actually just said, oh, do you want to do a podcast now? Now's a great time. Let's go ahead and start one next week. So I literally got it together within a week. And we had launched during quarantine. We did a full season. We have now 4 episodes that are up, and it's called 50 Shades of Beautiful.
Oh, I love that.
And it's all about that. So it's all about, we're all beautiful in our own right, no matter our skin color, our race, our background, where we came from. We all have that right to feel beautiful inside and out. And so it's a lot of that is the self-love and taking time and how do I work inner and the spiritual connectedness so that we can feel beautiful. No one needs to tell us what to do or what to have done or any of that. It's all about the inner peace, the inner beauty. And we all have it, but we've just been told otherwise. So bringing us back about redefining what that beauty is. So you can listen to it on Spotify and iTunes. 4 episodes are available, so you'll have to let me know what you think.
What's it called?
50 Shades. It's called Dr. Sonia's 50 Shades of Beautiful. So you can actually type in, if you go into Spotify, search 50 Shades of Beautiful, and you can subscribe. And same with iTunes. So
I love that.
My whole episode.
Wow. Oh my God. Okay.
I get to talk to so many people too.
I'm going to look that up for sure. Okay, so this is what I have, Dr. Sonia. I have the stem cell therapy cream. Okay, that's one thing.
Love that.
Then I have the liquid gold. That sounds good. Then I have the sheer skin shield. And then I have the medical grade skincare. So what do I do first, and kind of guide me?
Yes, so you've got 4 different wonderful medical grade skincare products. Now, one thing I want to always educate on is what's the difference? You have medical grade skincare at your home. What's the difference if you go to the drugstore, if you go to the department store, you go to Neiman's, which I think is actually bankrupt, so not them, but someone else.
You're so funny.
I was like so heartbroken when I heard all these,
I know.
business. But there is a difference between medical grade skincare and over the counter. What is the difference? Medical grade allows us to have higher concentrations of the good stuff,
Okay.
more potent, more pure ingredients made in an FDA lab, clinically backed. There's science, there's clinical studies that show that it actually works. We can go much more higher concentrated with great delivery systems, because what good is it if it's just sitting on top of the skin and it's not penetrating to do what it's supposed to do?
Well,
And
of course.
unfortunately, they can say, oh, I am a retinol product, and they can add a drop of retinol and say I'm a retinol product, but you don't get the benefits of
Oh.
what a retinol product does.
And how much are you paying for that, right? I mean,
You're
come
paying
on.
a lot of money for nothing, really. In fact, it can actually be worse for your skin because there's a lot of other fillers and preservatives and just things that you don't need for your skin. So I actually see more irritations from over-the-counter products.
Oh,
So
wow.
the difference is medical grade. That's my number one piece of advice when you get started. Start with
Okay.
medical grade. I'm sure everyone is after results, especially for anti-aging and brown spots, lines and wrinkles, pores, acne, breakouts. All of these are common um, concerns people have. So if
Of
you have
course.
concerns or problematic skin, you should be on medical grade skincare. Now, if you just wanted basic basic skincare, and you've got pretty good skin and you don't really have any other issues, and you just want to cleanse and moisturize and have a good sunblock, you could do some over the counter. But most of the people that I'm seeing have issues, or they want prevention, or what do I do so I don't need to do surgery later? What do I do so I don't need as much Botox or fillers? Well, skincare is 50% of the job, and using and investing in the best medical grade skincare is part of the job. So
well, I think you hit on something really that resonated with me, and that's prevention. I would rather get the medical grade now and have less to do later, so to speak. I mean, I have any problem with fillers or Botox or plastic surgery that works for you. Just to look your best for the age you're at. Matter of fact, I think it's fabulous. But I want to do my part in the prevention as well. So absolutely. I love it. I mean, even if you're in your 20s or 30s, right?
20s. Doris Day said the best thing you can wear in your 50s is sunscreen in your 20s.
Yeah.
And that's so true.
Yeah. So what do I start with here, and how much do I use and all that stuff?
So you've got 4 different steps. The brightening scrub is the first step.
Okay,
and
the brightening.
that one is
Which
one
one is that?
it's probably the biggest, thickest bottle.
Oh, okay, yeah.
I believe. Yes. Is that the brightening scrub? Is that what it says there?
Medical grade skincare. Yes, the brightening scrub. Yeah. Yeah.
Perfect. Okay, this is my ultimate favorite exfoliator. It's a great exfoliator for home. Now, why do we need exfoliation? Because as we age, there it is, as we age, our skin cells on top of the skin, they get all glued up. They're glued and they stick to the skin, and we want to unglue them. And
I had no idea.
Yes,
Are you kidding me?
Exfoliate them off. We need to let the new glowing skin come through. So people who have dull skin is probably because they've got all that dead skin layer that doesn't belong. It's just glued on top of the skin surface.
Okay, that actually sounds kind of yucky. That's motivation enough for me.
So you're going to be doing your job with exfoliating. And literally, I just keep it in my shower. I do maybe about a nickel size.
A nickel size just for the face, neck too?
You could do it actually down into the neck and décolleté as well.
Okay.
As long as you don't have sensitive skin and you can tolerate, these have little micro beads in it. They have great technology, and they also have a little acid in there to help break up some of those glued cells. So it's got a little bit of a gritty feeling because of these micro beads that are doing the job with mechanical and chemical exfoliation for your skin.
Okay, so nickel size in the shower every day.
Yes.
Got it. Okay, what's
Jules,
next?
do you have sensitive skin or normal,
No,
dry?
I'd say normal. I'd say normal. Yeah.
You could actually use this at night as well. I would say maybe in the beginning, go once a day if no problems. You could even use it at night to do like your first cleanse for removing your makeup. Now,
Oh,
I like double cleansing so that way you remove all of your makeup, but that's
okay.
the first step also that you could do at nighttime. As long as you don't have terribly sensitive skin, you can exfoliate. You can exfoliate daily or every other day would be fine, but you want to get those dead skin layers off.
Okay, question for you. What about if I'm going to start it once a day, because I always take all my makeup off at night, so I wake up with, other than what happens in the night, a fresh face. What about if I start at night first to take all the makeup off? Is that okay?
That sounds reasonable. Perfectly
Okay,
fine. Yes.
and see how I do. Okay, so what's next?
Next, you have the sunblock. Well, you have a moisturizer, which is your phyto stem cell. I love the phyto stem cell for you because it's going to be that one. Yes,
Oh, yeah.
great moisturizing step. This is so wonderful. It actually, I'll tell people to use it at night, but I love it for the day and night. It's very
Okay.
reparative. It's very moisturizing. It's got a bunch of different, it's power packed with ingredients in it. It actually is supposed to mimic your natural barrier of your skin. So it's got these beautiful, peptides, antioxidants, resveratrol, the stuff that's in the pigment that's in red wine. It's also anti-aging, the resveratrol. So there's some of that, as well as green tea, which is very calming for the skin. Great, very potent antioxidant as well. So that when you're out and about during your day and you've done the damage, well, these antioxidants are going to be really important to reverse some of the pollution and environmental factors that went into degrading your skin. So, and the stem cells are wonderful for helping to create some of that collagen, those growth factors. And the peptides are going to also help with prevention, and because it's creating back some of that lost collagen, but it's also hugely hydrating too.
Okay, so how many times a day on this?
I would do it twice a day. It's one pump. Basically, just go ahead and pump it up and all over on your face. You could even do it down your neck and décolleté area.
Okay, now I'm always aware. What about under the eyes? Yes or no?
Yes, I love it under the eyes as well.
Right here? No problem?
No problem. Yeah, no sensitivity. We'll use this after surgeries or after laser resurfacing when their skin is raw and we need the healing component. So it's a very healing, very repairing, very moisturizing formula.
Okay, twice a day on that. One pump, and under the eyes is okay, down to the décolleté.
Yes.
Got it. Okay, I'm
and
good.
By the way, all of these are oil-free. They're not going to clog your pores. They're gluten-free, vegan, paraben-free, hypoallergenic. So you won't have any, and cruelty-free. It doesn't get tested on animals.
Nice. So that's as natural as we can get. That's good. Okay, and we have two left.
And then we've got your sun shield, which is going to be sheer sun shield is your sunblock. You're going to use that in your day. That is the same moisturizing sunblock that I use. I love this for anybody who has any sort of sensitivity, anybody who wants the best protection. It's got high zinc oxide, which is about 17%. Doesn't appear white or thick. It's very sheer and translucent. You could wear it all over face, neck, décolleté without breaking out. Most of my patients who have acne or breakout issues is because they're using the wrong sunscreen.
Oh.
Chemical sunscreen is not good for everyone's skin. It breaks you out and causes all sorts of issues. With physical mineral-based sunscreen that are more pure zinc, it's like little shields just sitting on your skin, so it bounces off the sun's radiation. So literally it's like a barrier. It's a shield, so nothing can penetrate into the skin. So that's
is this just face though and neck? That's it? Like
you could do it anywhere else you'd like. However, because of the packaging of that, and because it is so highly concentrated, I usually tell people to use it all over of their daily wear, face, neck, and chest. But I love, eventually, if we're going to be outdoors a lot, I also like this for reapplication. It's a brush, which is the pearl powder. Or for the body, I have a spray. And the spray is just easy if you're going to be out on, like, by the pool or vacation.
Okay.
But daily wear, you could certainly use that anywhere you'd like.
Okay, awesome. Okay, so I have, now this, I'm intrigued by the name alone, liquid gold. So what's this baby doing for me?
Yes, it literally is liquid gold. Like, this is the most amount of science that you could possibly get in a bottle. So the two things that we know, dermatologists know, Liquid Gold, which is a retinol formula.
Oh, now I was waiting for that word retinol because I hear all these buzzwords, but I'm not really sure what it is. You know, I go to the drugstore and I see it on just every package, but really, for those of us who don't know, boil down the ocean on retinol if you would for us, Dr. Sonia.
So retinol is a very important, it's a vitamin A cream serum, comes in different bases. What people might remember, it's like Retin-A. It's what we used to use for acne, which we still use for acne. It's a vitamin A cream, and it helps by penetrating into the skin to produce collagen, which is why it's so great for anti-aging. But that little bit also has lots of other benefits, including helping with cellular turnover. Remember those ungluing of the cells. It also helps with pigmentation because it helps get to the epidermis and just calms down those pigment producing cells. It also gets into the dermis to help with collagen building. So it helps with tone and pores and acne, prevention of lines and wrinkles and brown spots and sun damage. It does all of this in one little bottle, which is
does it do tightening at all or no?
I mean, you're getting collagen stimulation, which is still one component of skin tightening. So it's very preventative. Once I found out about this miracle, literally this miracle formula, this retinol, I mean, I got on it since my residency days back in when I was in my 20s. And
that's why you look so good.
Time. Oh, I did a talk earlier today and I showed a picture when I was in my 20s. You want to see it?
Yes, of course you can.
Hang on. Let me grab that.
Unless it's going to make me not like you anymore. I'm not sure. Just joking.
So I actually showed my picture in my 20s. Here I am.
Oh my God, Dr. Sonia, you look like the same person. You're lucky I like you, or I don't think I would like you.
Literally.
That's incredible. And you've been, oh my God, Dr. Sonia. Well, you're a dermatologist. You deserve it.
You just need liquid gold and sunblock every single day, and you're going to get the highest level of prevention over decades that you possibly can. And I don't do a whole lot. I mean, I just do my basic work in the office and some facials and, some Botox here and there, but I'm not like doing every single procedure that's there because part of it is just, I want to be as natural as possible.
You look totally, completely natural, but yeah, absolutely. Okay. So how much of this do I use and how often?
So this is only a nighttime product, and you're going to use one pump, basically dotted in all 4 areas of your face.
And do we put that under the eye or no?
So no eye area.
No.
Because it's very strong.
Okay.
And I want you to go very slow, maybe about 2 or 3 nights a week initially to start. It is very common and normal for everyone to have a little bit of dryness or redness or tingling and that sort of thing because it's highly concentrated, and we do need to make sure that we allow your skin to acclimate, and that takes some time. So over the next month, your skin will acclimate, and then you can go up. So after a couple of weeks, then you go to every other day with your moisturizer, your phytostem cell, and then you'll eventually be able to get on it every single night. That's what we want you.
Okay, so you cut out a little bit. So it's one pump. Is that what you said?
One pump, dot in all 4 areas of your face.
Okay.
And you're going to gently dab that in.
Okay.
With your phytostem cell therapy on top.
Okay, so with this stuff, let me think. This stuff on top.
Yes, that's your moisturizer, your moisturizing reparative cream.
Okay, so that's it at night, right? I'm going to clean with the brightening scrub. That's easy.
Yes.
And this is my sunscreen. That's easy. But at night, this comes first. Yes. This is on top.
Yes.
Okay. And to start out, you want me to do this like 3 nights a week right now?
Yes. If you don't get any dryness, redness, or peeling, then you can move it up to titrate up to every other night.
Okay.
You're still good after a couple of weeks, then every night.
Okay. And this is, now what is different about me being fair skinned versus someone who's not? Is that something we can touch on later? Would the products be different or what, Dr. Sonia?
Yeah, that's a great question. Skin of color, skin type, all of that will play a role into what kind of a regimen that we decide to individualize you for. Now, usually with skin of color, we also have like pigmentation issues, dark marks, things like that we want to get rid of. So sunblock and retinol is always going to be the way to go. But if I have more sensitive skin and I'm skin of color, I don't want to irritate my skin because that produces more hyperpigmentation. So I may want to be a little more slower, more gentler with skin of color. Now, if I've got pretty robust skin of color skin because I've just done it all and I've done Retin-A and things like that in the past and there's been no problems, then the higher up I can go, the better. My goal is to really get up to that high level to get the full effect that I possibly can without doing any procedures.
Okay. Well, what I want my viewers to know really, most importantly today, is Dr. Sonia has appeared on TV really nationally, on a lot of different segments and TV shows nationally. And the reason I bring this up is people look to her for expert advice. You've written a book, several books, right, Dr. Sonia? But once again, you're just really so down to earth for everybody. But not everybody can get to you personally. But how do we get to the benefits of your knowledge? Like your website or your concierge, tell people, of course, the best thing is to go in and see Dr. Sonia or her staff, but tell us how to really get the benefits of you for those who can't, maybe not today, but you're open now, right? You're open
Yes,
again? Tell us about that.
we just opened, but absolutely, I can't see everybody in house, so we actually do offer virtual consultations. So in the convenience and safety of your own home, we can actually do a consultation. I also have a beauty concierge team, so if you're interested in talking about products and individualizing a program, let them know that you're interested in talking to a beauty concierge expert, and they can do an individualized consultation, recommend products. You can visit our website, elitemdspa.com, and you can shop under store. And under store, we've actually revamped our whole website, actually got a facelift, literally. So it's now a new store shop that allows you to lock in savings as well, to get door delivery, basically automatically delivered to your door every 1, 2, or every 3 months. So
Oh, nice.
so the nice thing is that we're widely out there. You can definitely get a hold of our products, try them. I hope you love them as much as we do. And then if you really are on a great program, which is my goal for you, is everyone needs to be on a good medical grade program, including sunblock and the liquid gold. And then the idea is that you would just have automatic deliveries, and that way consistency is king, right? It
Right.
doesn't matter what you use if you're not consistent. So this is my way to enable everyone to stay very consistent while also saving money and keeping the safety door delivery option available for everybody. And you can certainly follow us on Instagram and Facebook for more beauty tips. And then, of course, our podcast, 50 Shades of Beautiful, to get really beautiful inside and out.
And how often is that podcast going to be airing, Dr. Sonia?
So we just signed on for a second season. So we're on a new episode every 2 weeks on Spotify, iTunes,
Nice.
Google Play. I mean, you can find us pretty widely out there.
I love it. Well, I'm going to start tonight. So I'd like to maybe film with you in a couple weeks and kind of tell you what I'm feeling, and maybe you can have some other products on your end that you could showcase for us for different skin types, because obviously I have a lot of different viewers, we're all made up of different colors, right? So if you do that, Dr. Sonia, that would be awesome.
Oh, it'd be my pleasure, my honor, my privilege. I'm happy to do this, and I'm so happy to talk to your audience of all 50 shades.
Thank you so much, Dr. Sonia. Keep doing great things. You're beautiful. We love you. Thank you for joining us today. Bye.